And bonjour, this is Bruno and Sreedhar. We're both in India. I'm in Bangalore, and Sreedhar is in Hyderabad. I'll see him tomorrow. And I'm going to show you a little bit where I am, and then we'll have a, a session today, a little bit different from the other session. I'll tell you what I'm doing, and then Sreedhar will give you an update on the progress of our development, and in particular, the work we're doing on Clin. But first, once a year, some of you know I go to India, and for me, it's a wonderful vacation and work, but it doesn't feel like work. And I visit 3 or 4 locations, usually Hyderabad, Bangalore, Delhi, Mumbai. I was in Mumbai a little bit earlier. I also usually have the chance, as I did yesterday, to go to visit a university. So I was at KMCT in Calicut, Kerala yesterday, meeting with students and faculty. We presented, I was a keynote speaker in front of hundreds of students. It was wonderful. Great participation. We talked about AI, the future of AI, the implication of AI in healthcare. And I find students very, sometimes we worry that students are going to be negative about AI. They were not. They understood how critical and unique of a time they're in and how they have an opportunity to play a big role. They were engineering students and also healthcare students. So I really had a wonderful time. So in a few minutes, I'm going to ask Sreedhar to give us an update on where we are with the development of Clin in particular and the roadmap. And then I'm going to meet with the team tomorrow and the day after tomorrow, and then we'll be back to France and back to the US after that. I'm going to say another comment is that when I come to India, I usually like to visit with oncologists. And so we had the chance to have a meeting with 5 oncologists in Mumbai, and also with Dr. Amol Kade, who's one of our friends, and had a special meeting with him as well. And what I got from all of this is how much oncologist physicians are aware that it's a special time for AI to impact the field of medicine. They're aware of how interesting of a time it is and how much AI is going to play a role in their career. They're early career physicians, and they're already using it quite a bit and very open to the way it's going to change many things in their profession. So that's it for my initial comments. I'm going to pass the baton now to Sreedhar to give a bit of again, roadmap of Clin. To you, Sreedhar. I'm going to be on mute in case there's a lot of background noise on mine.
Sure, Bruno. And by the way, there's not much of a noise coming from your side. It's all good. So we can hear you perfectly fine. And definitely excited to see you tomorrow, Bruno. We have quite packed schedule for tomorrow. We had team meetings, and as everyone knows, LARVOL is 100% remote. It's remote first and remote always company, but we never miss these opportunities to meet Bruno once a year. So these are like week-long meetings that happen in multiple locations, Bangalore, Delhi, Hyderabad, the main locations, but we do have some of these happening in smaller locations too. So it's always exciting to meet the entire team. The only opportunity probably to meet the team. And then definitely these are like kind of semi-formal meetings. We don't keep it fully formal. And we do welcome the families, by the way, Bruno, as you know, like people can join. We have anyone, by the way, interested to join our meetings. These are kind of open meetings. You can drop in. You can definitely listen to what are things that we've been working, especially in the oncology space. There are a lot of new things that we've been working on. So it's a good opportunity to catch up, to meet. And if there are any tigers on this call, Bruno, definitely I would say like don't miss the opportunity. We have quite a good attendance confirmed for tomorrow. But if there are people who are still on the fence thinking about joining, please do join us. It's going to be a fun session, and it's going to be a lot of sharing in terms of what our plans are, what direction we need to go, and all. So yeah, Bruno, that's going to be exciting to meet you tomorrow.
I want to add one more thing. So yesterday, after the meeting at KMCT in Calicut, we went to the beach. Okay, we went to the beach, and it was such a special time. We had a sunset on the beach. We were relaxed after a full day of meetings, and it was a very special time. We had a great time. There was actually a Starbucks, believe it or not, on the beach, probably the best Starbucks in the world, right? You would exit the Starbucks and it was a sand, and it was a very special time. We had a great time. We got our feet wet, some of us, and did a lot of fun time at the beach.
That's great to hear, Bruno. Yeah, it's of course getting a bit sunny. I'm just trying to look out of the window to see. Last week it was raining a lot, Bruno. So I'm sure you'll may feel a bit the Hyderabad heat, Bruno. So welcome. Let's see how it goes. But hopefully it's not raining that much. That's a good news, Bruno. Okay, so we can move on to some of the updates, Bruno. Let me quickly show like what we've been working on right now. Just 1 second. So first thing, Bruno, a lot of new developments on the chatbot front. The chatbot is fully integrated and fully mature right now. And one important thing that we added to chatbot is the option for users to upgrade. Right now, this is all freemium. Any users can open Clin and can access the chatbot without even logging in. But if there are users who wants to use it extensively for commercial purpose or for their digital work, they can always upgrade and they can get more number of credits. So right now, the credits are limited to 3 per user if you are not a registered user. There are a lot of quite a good amount of things that you could do even within these credit limits. But if someone is interested in doing more of research, we gave the option to upgrade the plan so that you will get more credits. So that's one of the exciting development, Bruno. We do see a lot of usage. We are getting quite a good amount of feedback, and I think the way we interact with the products, the chatbot kind of validates a bit, saying that we don't, people might not be interacting in the traditional way with products. They want to basically try to find the information, build the analytics exactly the way they are looking for, rather than going to a search, looking at a specific analytics or specific dashboard. It's all the conversation driven right now. And we continue to evolve, but right now, there's quite amount of work that is done behind the chatbot. Any comments or anything to add from your side, Bruno?
The whole idea of conversational UI, I think it's fascinating, and it's a deep trend. People want to talk to the data as opposed to be given set analytics in many cases. So I think we're going the right direction there.
It's actually right. The voice from the background. I am sorry for interrupting the great conversation that you both were having, Sreedhar. I know that you have a lot of technological angles that you've been showing us. Quickly, actually, I was excited to see everything that has been happening with the team. I am myself not in India, but it's great to see the excitement. I have a few questions actually about an event that Bruno was joining yesterday, and I saw a lot of students around you, Bruno. Would you like us to have a little more of a glimpse out of that? And of course, there's a lot of exciting opportunities at LARVOL itself as well. Would you like to touch slightly on that? It would be very useful for the audience as well. And I appreciate.
There might be some of the students listening today to the podcast, by the way, because our stats on social media were way up. It was very nice to see. The students that we presented to were engineering students and medical students, as I said, in third years for the most part. And one of our objectives when we do that is to find good candidates for internships or for positions with us. So we collected a few great resumes already. And the questions were very good. The engagement was fun. And it was a lot of sometimes when you're in a company, you talk among yourself, right? And you try to talk with customers, but customers are busy. So here it's a little bit of a different vibe to talk with just students about the intersection of AI and healthcare data and cancer data. So it was a lot of fun. Yeah, I enjoyed it. Yep. Back to you, Sreedhar.
Certainly looked like you were enjoying a lot, and yeah, I'll jump off. Thank you for the answer. I see a lot of traction as well, and we always appreciate traction. And if anybody's interested and cannot hand over the resumes in person, they can also go to the channels, LARVOL channels on social media channels, and we're very active on X and other areas. And Sreedhar, I know you have a lot of things to show. I'll let you carry forward the episode. Thank you very much.
Yes, and anybody who would like to connect with us, connect with me, or send us a resume. The best is to go to LinkedIn to find our company or to find me, and to connect, to follow us. Because I have a certain number of followers, LinkedIn forces you to have my email now. It's not my choice, but it's a LinkedIn policy. So my email is bruno@larvol.com, and you should be able to get in and connect that way.
Thanks, Bruno. Yeah, thanks, Shay. I know we are switching between two different topics, Bruno. So let's come back to Clin. So chatbot, and in addition to chatbot, we also continue to work on our mobile apps. Unfortunately, I will not be able to share the screen. It's not going to be that easy, but we do have the Android and the iOS app. That's a work in progress, but there are quite a good number of modules that are already available, and it's again on the App Store to download. So currently we have the feed integrated. We have the trial 360 page. We did integrate the conference tab, which is considered the most important for our customers, definitely. And we do have the influencer tab. So there are already these tabs that are available on the mobile app. And our team right now is working on building the next drug details page of the drug 360 module, Bruno. So that's something that hopefully in the next couple of weeks, we should be able to see that. So we've been picking one module at a time, and we have started putting it on the app, Bruno.
Clin, Google Map for cancer data, is amazingly free for non-commercial use. So check it out. It's quite remarkable. And frankly, I get into fights with my colleague all the time who say, well, why are we giving it for free? So we think that we'll be able to keep the non-commercial version free. And so please do use it. Tell us what you think, and give us feedback. We're here to build the best product we can, and we feel that the intersection of cancer data and AI deserve a ground truth, deserve a highly curated place where everything is sourced, everything has been checked, every Kaplan-Meier curve, every comment from an oncologist, every podcast, every publication, every poster. So we are enjoying building this product for the community and for pharmaceutical companies as well. Pharmaceutical companies, that's not free for them, right? But thank you very much for everybody's support. Please follow us on social media. Reach out if you have any questions. Thank you. Au revoir.